Madam Deputy Speaker, I commend the honourable member for Stroud for securing the debate and also for putting himself out there by calling for reformulation, a reformulation tax on sugar and salt. I would add that it's not just through penalties that we are going to tackle diets in this country, it's also through incentives. And today I want to talk about some incentives that are being used in East Devon, where I represent, Honiton and Sidmouth. It was recognised, I think, a long time ago that ultra-processed foods were not only linked to obesity, but were also contributing to malnutrition and to poor dental health too. And so I want to highlight some of the brilliant work being carried out by a charity called Project Food, which is dedicated to improving diets, promoting healthier lifestyles and reducing the burden of preventable disease in the community. Project Food is linked slightly to a restaurant called River Cottage, and one of the trustees there, Stuart Dodds, invited me to see Project Food in October of last year. They operate out of Axminster's Community Hospital, and that's entirely fitting that they should, because the work that they do is very much around public health. It's a shining example of grassroots public health action through free cooking demonstrations, hands-on sessions, one-to-one support and online classes. Project Food is empowering people to move away from ultra-processed foods. And yet they are finding it very difficult to keep up with the growing demand for their services in Devon. More families than ever are turning to them for help because of the high cost of nutritious food contrasts with the relative affordability of foods that are packed with sugar and palm oil. Alarmingly, a report by the Food Foundation revealed that low-income households now need to spend up to 50% of their disposable income on food if they are to meet the government recommendations around what is a healthy diet. Over 11% of UK households are experiencing food insecurity, and millions are, as we all know, turning to food banks if they aren't also then buying ultra-processed foods just to survive. And while this is a debate that is principally about diet and about food, we should think also about some of those co-benefits of reducing sugar intake. And I would point to dentistry on that one. I know that in Devon, fewer than half of children last year saw a dentist, and promoting healthy eating habits could reduce the strain not only on the wider NHS and on secondary care, but also on dentistry too. Tooth decay, we now know, is the leading cause of hospital admissions for children aged between 5 and 9. So this is plainly an area where working on reformulation of food could also help save money on dentistry too. I think earlier on there was a reference by the Honourable Member for Chelsea and Fulham into Natasha's Law. And we'll recall that Natasha's Law was about how we have allergens illustrated on food packaging. But also there was an extension to this in 2022, the calorie labelling regulations that came into effect that year. And this has served to help prevent obesity, and it has done so by ensuring that people, when they're going into a cafe or a restaurant, are able to see what it is that they are eating and the calories associated with the meal that they might choose. We should also recognise that this can have a negative effect. I had a constituent who came to me to talk about the calorie labelling regulations in 2022 and the effect that it had had on her daughter. Her daughter suffers from anorexia, and this requirement on large businesses to put calorie counts on menus has made it extremely difficult for her to go out with her daughter. It would tend to be the case that her daughter would take one look at the menu and simply refuse to eat anything, and it led to the family just simply not going out to eat out at all. And one way that perhaps the Minister might consider building on the calorie labelling regulations that were introduced in 2022 is to also require those same restaurants and cafes to have menus with no calorie counts on them, so that for families who seek to dine out can do so without fear of stressing out somebody who has an eating disorder. So to return finally to Project Food and how we can perhaps better support some of the community assets that we have to help us tackle obesity and improve diet. We should be thinking about the use of community hospitals. We have spare space in community hospitals at Axminster and at Ottery St Mary, where Project Food is operating out of. I would suggest that the work that is being carried out by Project Food would be very much suitable for social prescribing. It is definitely having a very positive effect on the people who I saw who are touching with that charity. They have done some excellent work. I suggest that their work could be scaled and could be implemented across the country so that with spare capacity we could see hubs for nutrition programs and other public health measures that support healthier communities, very much in line with what the government has been talking about in response to the Darcy report. By addressing poor nutrition head-on in the community, we can reduce inequality, improve lives, and alleviate the immense pressure on our health service. Thank you.